Today is move-in day at Butler. The school is one of a few in the state to require COVID vaccines, and students say they're looking forward to a normal college experience. Our Sarah Jones was there as they all got settled in.
It's move-in day at Butler. Some students were nervous that their first college experience might not be in person.
Kind of like nerve-wracking.
But these freshmen, along with their classmates, will get to have the full college experience.
The high school was definitely weird, and like getting quarantined and e-learning and everything like that. So to be back in person and like with all these people and meeting new people and stuff is really exciting.
The university says the pandemic didn't affect the number of incoming students.
We've got about 40 states covered here today, 15 some countries. We've been on a great streak here. It seems like every year we've got more students the year before, and that's the case this year with about 1,150 students. The diversity is at an all-time high. We had about 21% of our students have self-identified as students of color.
The school is taking strides to keep everyone safe. Their drive-through move-in system has been around for years, but it's helpful during the pandemic. The school hires a moving company to help students move into the dorms.
This is very organized.
When it comes to COVID, masks indoors, social distancing in classrooms, and vaccinations are required.
There is an opportunity to fill out a form for exemption.
The fact that they're requiring the students to be vaccinated unless they have a reason not to be, it's wonderful.
Some people are exempt for health or religious reasons, and the university does have a vaccination clinic on site.
We got about 93% of our faculty and staff are vaccinated. About 90% right now is students.
Freshmen say they're excited to start with what many will tell them are going to be the best years of their lives.
Well, Indiana's COVID numbers are soaring again. Look at these numbers. More than 4,100 Hoosiers tested positive for COVID yesterday. We haven't seen numbers like that since way back in mid-January. Take a look at the dotted line on this graphic. It shows the trend we're seeing here in Indiana. On average, the average number of cases is 13 times greater than it was just on July 1st. Officials say the key to slowing the spread is wearing masks and getting vaccinated. Most of the nation's young people seem to be interested in getting the COVID vaccine. Researchers with the University of Michigan polled over 1,000 14 to 24-year-olds. Nearly 75% said they were interested in getting vaccinated. Roughly 42% were concerned about adverse side effects. 73% believed the vaccines were safe and effective and said they trusted the science and the data. But those numbers look at those who were interested. Let's show you how it's playing out here in Indiana and across the nation. We took a look at the youngest group, kids between the ages of 12 and 15. That's where Indiana is lagging behind the rest of the country. In Indiana, just 25% of that group is vaccinated. Nationwide, it's a little higher, 33%, but that's still a lot of eligible school-age students who are not getting vaccinated. And more complications are still being found in unvaccinated people suffering from COVID. OBGYNs in Central Florida are urging pregnant women to get vaccinated after dealing with cases that have required life-saving interventions. One Florida doctor said the highly contagious Delta variant is what's driving an increase in complications in pregnant women.
Personally, I've done cesarean sections on women in the 3rd trimester so that after the baby was delivered, we could intubate the mothers and save their lives.
Other mothers are being sent home on oxygen to try to buy time before having to deliver the baby. They've also seen some success with monoclonal antibody treatments in some pregnant women.